When was the last time you went to a health facility to get your bone tested? As young people, we underrate the value of good bone health and only think that bone diseases only affect the elderly. But the surprise is bone disease can affect from the early childhood to the elderly. So it's important for us to visit health facilities for a wellness checkup on our bones. Remember, guys, that it is the bones that allow us to do our daily chores. It is the bones that allow you to walk around, to sit down, to dance. And when these bones are affected, your whole life almost comes to a standstill. If you're a smoker, you need to watch this video to the end. If you're a old person above 50 years, you need to stick around to this video to the end. If you suffer from arthritis or depreciating bones, you need to stick to the end. If you've ever gotten an accident and you fractured parts of your body, you also need to watch this video to the end. Ladies and gentlemen, and welcome to yet another episode of the Health Agenda. This is Up Close with Priscilla, where we cover all matters health as we tour different health facilities and engage different health specialists to showcase to you the available medical options. If you're new, karibu sana. My name is Priscilla, and as always, I'm glad to have you on my channel. Thank you for always coming back to watch my videos, and if you have not subscribed, please consider pressing that subscribe button and join the family. Today, guys, we are all about bone health, and on this we are coming live to you from the Rayhaan Healthcare located on the first floor of Park Medical Center. And as you can see right behind me, guys, as you come into this facility, you're welcomed by a very brilliant space that is well set up for comfort, for style, for functionality, and also with a touch of luxury. As you can see, the finishes are very elegant, just to provide a good space where you can chill and relax as you wait for your medical appointment.
My name is Dr. Tasneem Hassan. I'm a health specialist working at Rayhaan Healthcare. At Rayhaan Healthcare, we have the most advanced technology for measuring your bone density. This is known as the bone Dexa scan. So what is that? A bone Dexa scan is an imaging test that carefully measures the bone strength, that is known as the bone mineral density. This Dexa scan also measures the visceral fat and the total muscle mass.
My name is Dr. Mustafa Baiji. I'm a consultant radiologist at Rayhaan Healthcare, and I'm the one who is responsible for interpreting the bone Dexa scans. This is our bone Dexa room with our bone Dexa machine. This is it's the gold standard for bone density measurements. Okay, it is the latest technology. Yeah, we are probably the second facility in the whole of Kenya to have a machine of this caliber. Yeah, it gives very low radiation. Yeah, you can even stand in the room while the patient is being scanned, and the whole body from the head to toe can be scanned. Yeah, apart from the bone density, it also gives us input on the muscle mass and the fat mass. So those are other applications of this bone density scanner, which have not been explored in the whole of the Eastern African region.
So guys, like you've heard from the specialists, today we are all about bone health, and we are doing it here at the Rayhaan Healthcare. So this is the bone density scan that is being called the Dexa machine. This is where you get the scan for the bones to test osteoporosis and osteopenia. As we speak, guys, there are only 2 machines in Kenya, so only this at Rayhaan and another one facility to check your bones. So this is the very state-of-the-art equipment that will make sure that you get the highest and accurate test results about your bones.
Who should get a Dexa scan? Any elderly patient, so for any aged above 50 years, postmenopausal women, anyone aged 65 years and older, anyone with a history of alcohol and smoking, with a history of corticosteroid usage, and as a general wellness checkup. As a matter of radiation, I can be in the room when we're doing the scan, so you can imagine the exposure to that radiation. It's like 0.001 compared to the older methods that were there, X-rays, the CT. The exposure to radiation at that time was quite a bit. Osteoporosis is a systemic skeletal disease characterized by low bone mineral density. This makes the bones become less dense, brittle, and eventually fragility fractures develop. We have 8.9 million cases every year, of which we get 1 fracture every 3 seconds. And from that, 1 in 3 women and 1 in 5 men get an osteoporotic fracture in their lifetime. Osteoporosis in Africa, we don't have much research done on it because of several reasons. It has been neglected. 1, because of other diseases like tuberculosis, HIV and AIDS. Another important factor is there is a misconception that osteoporosis does not affect the African race. That is false. It actually, in the last 50 years, the burden of osteoporosis has been increasing, not only in the Caucasian, Asian, but also the African race. Another reason why osteoporosis has been neglected is because of we don't have the Dexa machines available in our country. So for primary osteoporosis, it's age-related and postmenopausal women. For secondary osteoporosis, there are many causes, drug-induced diseases like rheumatoid arthritis. If you are on cancer drugs, treatment on that. If you are diabetic, you're taking treatments for diabetic. All these eventually expose you to osteoporosis. If you're also taking other drugs like say diabetic medications, you're on cytotoxic drugs, you're on protease inhibitors for the HIV, all these will, long-term usage of these drugs will reduce your bone mineral density, and this exposes you to osteoporosis. Specifically for osteoporosis, it affects your hip joint, the wrist, and the spine. So one thing is, this disease is asymptomatic. You see, by the time the patient comes to you, they have a fracture. So for you, you have to pick it either earlier from, let's say you pick from the risk factors and the patient's risk factors like the age and everything of that sort, and then you, as a health practitioner, you can refer them to the facility for a checkup. As I mentioned earlier, it's asymptomatic, but the few telltale signs that a patient would come with is, say, a back pain. You'd see a hunchback. There will be loss of height because of the bones being compressed and all, so there will be hunchback, and some might complain of hip joint. But as you age and all women and all the sedentary lifestyle and everything, people take this as a routine, it's just a normal back pain and you tend to miss it. So by the time they're here with you at the doctor, they're already having a fracture. It's too late. So if we can try and intervene early as a health practitioner, if people actually know that we have such a scan that is there in the country, we could actually prevent the disease. Once you do the test, you can either fall under normal, osteopenia, or osteoporosis. So if you're at normal, we'll try and prevent you from getting into the bone disease. If you are rich at osteopenia, we have some prevention measures you can do. You could start with lifestyle, cut down on your alcohol and smoking. You can do exercises. You can increase your calcium and vitamin D supplements. You can stop alcohol and smoking. If you're having a sedentary lifestyle, you can do a bit of exercise, walking. All that would improve your bone health. And by the time the test shows that you have osteoporosis, we don't end there. There are some treatments right now that you can do. So again, we start with the basic lifestyle, do the calcium and vitamin D supplements, and then you start them on treatment. Like biphosphonates are available, we have newer agents. What we are trying to do is educate the public on our machine, that we have it. Like I mentioned earlier, we're among the few health facilities that have it at a very cost-effective price. So if we can pick the disease early, we can actually prevent the fractures that happen from osteoporosis, because osteoporosis basically means porous bone. By the time you're having porous bone, you are exposed to fracture. Just a little fall, a little bump, a little slippery on the floor, you have a fracture. And the disability from fractures is quite long. So you rather treat or rather prevent and screen the patient before you come to the cost for the treatment.
As we continue with the tour of Rayhaan Healthcare, I'm outside the CT scan room, as you can see right behind me. I would wish to mention that this facility, guys, has taken time to invest in the best technology. They have very modern imaging, digital technology to make sure that when you visit them, you get the best results of your diagnosis. So guys, as you can see behind me is a 128 slice CT scan with an AI integration to make sure that you get the best quality results of your diagnosis. This is a tour of the ultrasound room. As you can see, they have invested in very good digital imaging machines just to make sure that you get the best results when you come for your diagnosis. So as you can see, this is their ultrasound facility. So let's move on to their X-ray and mammogram rooms. This is their X-ray machine. Here we are inside their X-ray room, and as you can see, guys, these are all the equipment that have been installed here for their radiology. Very modern technology, digital imaging machines that have been installed here to make sure that you get quality test results. They also offer mammogram services. We've shown this in our previous video. If you haven't watched our Rayhaan video, please watch it. We have explained about the mammogram. So at Rayhaan, they also offer these services. You can come here for your mammogram and breast cancer checkup. So be sure to visit them, guys. So guys, this is where we wrap up our tour today of Rayhaan Healthcare. I hope you have enjoyed watching this video and you have learned a lot of insights concerning your bones and your bone health. I'll leave more information about this video on the description box down below, so be sure to check it out. If you have enjoyed watching today's episode, be sure some love by clicking the like button. Also, if you haven't subscribed, please consider subscribing. Until the next one,